Hi, this is Dr. Kingston, and in this video, we'll be talking about some oral cavity innervation. And specifically, we're going to talk about innervation of the cheeks, the teeth, and the gingivae. I want to start off here painting with some really broad strokes. We'll get at the big picture of oral cavity innervation before we start talking about details. So when it comes to somatic sensory innervation, the oral cavity is in the head, and all sensory innervation for the head is carried by the trigeminal nerve. Now, the oral cavity is separated into a superior maxillary half and an inferior mandibular half. And a lot of movement occurs between these two halves, right? Every time we move our jaw, we're changing the shape of the oral cavity. It makes sense then that we're going to have one pathway for innervation of the maxillary half and another for the mandibular half. And luckily for us, the names of the nerves, the divisions of the trigeminal that innervate these regions reflect this really well. So everything in the maxillary part of the oral cavity is going to be innervated by branches of the maxillary nerve, or that second division of trigeminal. Everything in the mandibular part, or the lower part of the oral cavity in the cheeks, are going to be innervated by branches of the mandibular nerve, which is the third division of trigeminal. So everything will come back to one of these two nerves. The big picture for somatic motor innervation isn't much more complicated. Most motor innervation for this region is heading for the tongue, and we're going to address that in its own learning objective. So for this one, we're just going to leave that as a blank. The remaining motor innervation is headed to the cheeks and the lips. And the muscles in these regions are all considered to be muscles of facial expression. That means that they follow the rule that says all muscles of facial expression are innervated by branches of the facial nerve. Specifically, we see that the zygomatic branches of the facial nerve, so these purple guys here, are going to be innervating some of the upper lip and upper cheek. The buccal branches are going to be innervating this buccinator muscle specifically here. And then some of the mandibular branches will innervate the lower aspect of the lip, so that orbicularis oris muscle gets innervation from the zygomatic branches and the mandibular branches. So with these big rules in mind, let's take a look at some more specific structures. The cheeks are made up of an outer layer of skin, the buccinator muscle sandwiched in the middle, and then an inner layer of mucosa or mucous membrane. The buccinator muscle gets motor innervation from the buccal branches of the facial nerve. The skin and mucosa here are going to receive somatic sensory innervation from the buccal nerve, which is not the same thing as those buccal branches. You'll be much more familiar with the branching of all of these nerves by the end of this module, I promise. But this buccal nerve that we're talking about is a branch of the mandibular division of trigeminal. And that buccinator muscle, even though it sits deep in the cheek, is still considered to be a muscle of facial expression. So you can see in this lovely photo here how it changes the shape of your face when it fires. But more importantly than giving you that kind of gaunt, sunken, starving look, the buccinator functions mostly to hold food in place while you're chewing. So it tenses up the cheek right next to your molars, and it prevents food from falling laterally out into the oral vestibule while your teeth are working. So it's one of those important functions that you never really think about until it stops working. People with facial nerve palsy will report difficulty chewing properly because they can't keep their food in between their teeth. All right, the teeth receive purely sensory innervation. Not really surprising because they're pretty solidly rooted in place. The maxillary teeth, again, are going to receive innervation from branches of the maxillary nerve. All right, so we are going to start off in the cranial cavity with our trigeminal nerve. So that's way back here. And as we come out, we are going to branch onto that maxillary division, which comes down into a place called the pterygopalatine fossa. And then it continues on from there as the infraorbital nerve. Okay? So from that infraorbital nerve and from the trunk of the mandibular nerve is where we're going to get all these branches for the superior or maxillary teeth. All right, so the posterior superior alveolar nerve comes directly off the trunk of the maxillary nerve. And then the infraorbital gives rise to the middle superior alveolar and the anterior superior alveolar. And all of these then participate in what's called the superior dental plexus, where they mix together a little bit and then send down branches to those anterior teeth. So the way this breaks down is that the anterior superior alveolar nerve sends branches to the incisors and canine. The middle superior alveolar nerves send branches to the premolars and first molar. And then the posterior superior alveolar nerve, that is such a mouthful, sends branches to all three molars. All right, I am going to switch color here. So we've got warm colors on top. Let's do cool colors on the bottom. How do I change my color? Should be better at this by now. All right, let's do blue. All right, so for our mandibular teeth, then again, we are starting off on the trigeminal nerve here, and this time we're going to branch off with the mandibular nerve. Specifically, we're going to branch off onto a nerve called the inferior alveolar nerve, which is going to enter into the mandible. Okay, and we'll talk a little bit more about this pathway in upcoming modules. For right now, it's enough to know it's going into the mandible. And as it is coming through here, it gives off little dental branches here to our posterior teeth. And then it exits out of the mandible back onto the face as something called the mental nerve. And the branches it gives to the teeth after this has happened, okay, are called incisive branches. So these will come up like so. Okay, so we've got dental branches posteriorly going to our three molars and two premolars. And then we've got little anterior incisive branches going to our incisors, our canine, and our first premolar. All right, the gingivae receive somatic information from the same nerves that innervate the structures around them. Now, look at this. This is a mess. So let's sort it out. Let's make it easier. We're going to start down on the bottom with our mandibular tooth row. All right. So the first thing that I want you to do here is to imagine that tooth row as a wall. All right. They're blocking off the oral cavity from the oral vestibule. For the gingivae in the oral vestibule, so that would be the buccal and labial gingivae, they are going to share the nerves of whatever is supplying the cheek and the lip. All right. For our mandibular teeth, that is going to be our buccal nerve, a branch of V3, and our mental nerve, which is also a branch of V3 through we saw that come down here from the inferior alveolar nerve. So that was here. We've got mandibular here. Here's our inferior alveolar nerve. And then this was our mental nerve down here. So that's sending a couple branches back in to get to the gingivae here. The buccal nerve, I'm just going to show you right here, is this branch here. So that is going to be sending off branches to the mucosa and skin of the cheek here. And then it is also going to get the gingiva around these posterior teeth. All right, so that's pretty easy. In the oral cavity proper, so the lingual side of the teeth, everything in there, the anterior 2/3 of the tongue, the oral mucosa on the floor of the mouth, that is all innervated by the lingual nerve. So the gingivae here are innervated by the lingual nerve as well. All right, so one for the middle, 2 for the sides, good to go. Now, the maxillary gingivae look a lot messier, but it's really the same pattern with just a little bit of a twist to it. So the roof of the oral cavity is the hard palate, and the lingual gingivae here will share some branches of the greater palatine nerve, the purple, and the nasopalatine nerve anteriorly. Okay, the buccal gingivae again are going to be sharing innervation with the cheeks. So again, this is the buccal nerve for the molar gingiva. Anteriorly, again, sharing innervation with the labia or lips. So for the upper lip, this comes from the infraorbital nerve. For the, let me actually just draw these on here for you. And then let me change my color so we're not confused. All right, so we've got our maxillary nerve here coming off the trigeminal again. And we've got the infraorbital nerve here that comes out and distributes onto the skin of the face like so. And that is going to be sending some branches down to the labia right here as well. All right, so the anterior teeth there have some branches coming down from the infraorbital nerve like that. And the buccal nerve, because it's down here in the cheek, will also be sending out a few branches to get to the gingivae of the posterior superior teeth as well. All right, so that's exactly the same pattern as we saw on the bottom. What makes this look especially messy is that these nerves are getting an assist from the same nerves that innervate the teeth. Okay? So what's going on here is we've got the infraorbital nerve up front getting a little bit of a boost from the anterior superior and middle superior alveolar nerves. And we've got the buccal nerve posteriorly getting a little bit of a boost from that posterior superior alveolar nerve. That's all that's going on here. So for the maxillary teeth, the nerves that innervate the teeth specifically help out the nerves innervating the buccal and labial gingiva. That's all that's going on here. And for your studying ease, I have put those rules into a handy little chart here for you. This separates each of the 4 big regions for your gingivae. So we've got maxillary gingivae up here, mandibular gingivae down here, and then it is divided up to the buccal labial, or you can think of these as the oral vestibule gingiva, or the lingual or oral cavity poplar gingivae. All right, so please feel free to use this as you're studying to help you remember these rules rather than trying to study each individual tooth and its surrounding gingiva. And that is going to bring us to the end of this video. So here is your review question. You need to anesthetize your patient's lower first premolar for a procedure. Which nerve or nerves should you target? All right, the correct answer here is C, the inferior alveolar. Now, the first premolar, if we look at what exactly is innervating it, so we are looking at our first mandibular premolar, which is this tooth right here. It has shared innervation from some of the dental branches of the inferior alveolar and some incisive branches of the inferior alveolar. Now, the fun thing about this is you don't have to target either of those. You can actually target the entire tooth row here by targeting that inferior alveolar nerve. Okay, so that branches right here. Here's V3. Here's the inferior alveolar branch that's going into the mandible. And as it does, here's the hole it goes into. You can actually target the nerve as it goes into this hole by aiming for this little spike of bone here called the lingula. Now, you'll learn a lot more about this both in upcoming sessions and in your future coursework, but this is a good thing to know. All right, and that is going to bring us to the end Thank you very much for joining me.